At the same time here, so bear with me. Hey guys, welcome to Thoughtful Tuesdays. I'm Lori Lordson, addiction therapist, yoga therapist, all that good stuff. I'm here on our Thoughtful Tuesday to talk about the biopsychosocial model of not only addiction treatment or treatment in general, but of health. So I'm going to give you all a few minutes to find your way on. I was running around trying to get on. A few minutes, let me say 30 seconds, because I'm not going to spend too much time here, guys, or I will lose y'all. So, and bear with me, hopefully I have enough power here, because of course all my devices are dying right now. And I was getting my oil changed, so I didn't get a chance to get everything charged. So hopefully you guys can bear with me and learn a little something. This is a topic that I will return to many times. You'll probably get sick of hearing me say it. So if you miss it or if we lose each other, then I will definitely talk about it again. So, and I am on Facebook and Instagram. So if you see me switching back and forth, that's what's going on here. I haven't figured out how to put them two together yet. So if anybody's more tech savvy than me, then please let me know. I know I can send them from one to the other, but it doesn't go live in both places. So anyway, the biopsychosocial model, without further ado, thanks for you guys who are there. Hi, Gwen and Fran and Bob. It's nice to see you guys there on my Instagram. So when I talk about the biopsychosocial spiritual model of addiction, we talk about it like there's like the four legs of a chair. So if you think about a chair, there's four legs on the chair. Each leg represents a part of the system. That's my favorite visual. So if you think about that, let's start with the biological piece. So when we talk about the biological part of addiction and of treatment and health, we're talking about nutrition. We're talking about medication if you need it. We're talking about sleep, all the ways that we take care of ourselves physically. Because if we don't take care of ourselves physically, then emotionally, we're not going to do real well. In addiction, we have, in 12-step, we have this term called HALT, hungry, angry, lonely, tired. So, and a lot of that stuff comes from physical, the biological. So, that's the first piece. And then the psychological would be the taking care of your emotional health, your mental health. So that might be where therapy comes in. That might be where essential oils come in, taking care of yourself, self-care as we know it, like taking a bath or doing deep breathing, learning skills to have optimal health and sobriety if that's part of what you're looking at. The social aspect is all the people in your world, right? So when we're talking addiction treatment, we're talking 12-step meetings, we're talking your friends, your coworkers, your family, the support system that you have. So that's the social part of the biopsychosocial spiritual model. And the spiritual part would be church or any type of spiritual practice like meditation. Yoga can be a spiritual practice as well as a physical and emotional practice. Any type of spiritual practice. So if you go to a mosque, if you go to a oh my God, what's the Jewish one called? I'm drawing a blank right now. Somebody help me out. Temple. Any of those things. Those are all the spiritual part of it. So part of the reason I brought up the biopsychosocial spiritual model, which is the kind of an encompassing piece of all of addiction treatment. We want to look at all of those things. Whenever you're treating anything in your life, you want to look at all of those things. But part of the reason that I wanted to bring that up today is I've been having conversations with a few people about medication. Now, I'm not a medical professional, so I have to put that qualifier out there. But a lot of people, especially people in recovery, they don't want to be on medication. They say, way back in the day in AA and NA, they used to say if you're on any sort of medication, you're not really in recovery. So there's one, and that can be really dangerous. That can actually, kill a lot of people. Because when you have a diagnosed mental illness, when you have depression, anxiety, bipolar disorder, things like that, sometimes medication is necessary. So the biggest thing that I wanted you to hear related to that is that all of those things have to be taken care of together. So if you look at them again, like I said before, as the four legs of a chair. So if you take away one of those legs, so let's say you have depression or you have suicidal thoughts and you have really severe depression, you can't get out of bed, you're having a hard time working, whatever the case may be. Sometimes the idea is let's pick yourself up by your bootstraps and work, but that doesn't really work for people in that kind of state. So if you were to take that away and not take away the medication and not be in a good space, whether it's that or just going through a transition in your life, what happens to that chair? Think about it. That chair is going to become wobbly at the very least, if not fall over. So when thinking about any sort of treatment and any sort of health, you want to look at each of those four aspects. And how am I doing in that? It's kind of, an inventory, if you will. I hope you guys can still hear me. I think it paused. It's kind of an inventory, if you will, checking in with yourself. Where am I at? What am I doing biologically? Am I taking care of my nutrition? Am I sleeping enough? Am I taking my medication if that's something that's been recommended by my doctor who understands what I'm going through, who understands my depression or my addiction, whatever the case may be? Because that's a really important aspect of it as well. Being not only an informed consumer, but having a doctor that understands, because there are a lot of doctors who don't really understand addiction, or it's not really their piece. So having someone, a doctor, a therapist, all of those things who do understand is really important. So psychologically, am I avoiding my feelings? Am I stuffing them with food or drugs or alcohol, or even something fun? Even just binge watching TV or whatever the case may be, or am I addressing some of those feelings? Because sometimes those feelings of depression, those feelings of anxiety are there to serve a purpose. I might even say all the time, they're there to serve some sort of purpose. That purpose might be to tell you need some medication or something to help get you to a level where you can do the work of the therapy, of the exercise, the yoga, the spiritual practices, getting out and meeting people. Because if you're so depressed or anxious you can't get out of bed, how are you going to build your support system? How are you going to go to a meeting? Some of us even stop talking to our family when we're feeling that way. So it's really important to take a look at all aspects of those things. And even as a healthy person, how am I doing in all of those things? How do I maintain health? How do I maintain, sorry guys, stuff in my face. How do I maintain all of those aspects of the chair, that biopsychosocial spiritual model, to be a healthy person, to grow as a person, and to get better? So just like my 1 minute brain model that I talked to you guys about, it's been a little bit more than 1 minute, but I wanted to kind of give you an introduction of the biopsychosocial spiritual model of treatment. And yes, it's a huge mouthful. So remember, it's the biological, the psychological, the social, and the spiritual. So treating all aspects of yourself, of us as human beings, is really, really important to stay healthy. And like I said, one of the most important pieces of that is having someone that you can talk to, having someone that can help you with all of those things. And as a therapist, that's certainly something that I can do. So if you have any questions, or if there's anything that I can do for you, any way I can support you, you can certainly reach out to me here on Facebook or Instagram. And my links are also in my bio. So I really appreciate those of you who are watching. Those of you who are watching, if you have any questions, it doesn't have to be about you. I would really love to get some more engagement. I'm just coming up with topics every week that I think might be important to you guys, but I'd love to hear what is important to you, and if there's any way that I can answer questions about therapy, about addiction treatment, mental health, yoga, essential oils. Those are all the things that I might be able to tell you a little bit about. So please feel free to reach out with questions, either here on my live or any of the social media outlets. I would love to hear from you. Okay? Thanks so much for watching again, and I will see you next week for Thoughtful Tuesdays. Have a great week.